What does innovation actually kind of mean to you at this point? These bigger companies are starting to do it for you instead of, especially in the healthcare, innovation has a much different definition than a lot of other industries. How do you actually handle innovation and trying to push the envelope in your own journey?
So we break down innovation into two elements, right? There's capital I innovation and there's small I innovation. And for me, most of the innovation that we're working on in our industry is just making sure that I'm ahead of the people down the street, right? I don't have to be doing anything that's going to knock the socks off of the industry. I just have to be a little bit faster, a little bit more nimble, and a little bit more appealing than my competition down the street. And we're in two different states and a number of different cities. So there is different competition in different marketplaces. So we have to pay attention kind of on a broad perspective. But for the most part, that is most of who I'm competing with. That is affordable innovation. Now, the capital I innovation is about doing something completely new and different. Thinking about delivering a service in a way that's never been done before, or delivering a service that's never been delivered before. And I think that the challenge is that's what these other technology industries or the other technology companies can begin to do. They can start to compete with me because in the digital world, we are right down the street from each other. And those organizations have deep pockets and they have diversified revenue streams. Most healthcare systems 10 years ago had one revenue stream, right? That was providing care. How many other industries or business in the world have their payments absolutely controlled by either the federal government or by very large competitors in some ways when you think about health plans, such that I don't have a lot of diversification. I don't have a lot of ability to generate new revenue, new capital in order to be very innovative as an industry. We're struggling with that as a company, but then I think that's a big problem that many health systems are having. And what you're seeing is some of the biggest health systems now are really starting to diversify. They've got their own investment portfolios. They're investing in companies rather than contracting with companies to do work. They're investing in those companies to do work for them. Very different space.
So you're seeing that as almost a change in the way that you approach your transformations for these organizations then going forward.
In some ways, yes.
Instead of buying the service, you're actually investing in the organization so they become part of your organization.
Exactly. And I mean, there are places like UPMC, they've been doing this for years. I think Mayo has been doing this for years. You know, if you're a good enough company for me to spend tens of millions of dollars on you to do me a service, why not spend tens of millions of dollars to own part of your company? I mean, seems like a lot more sensible way to approach it.